Also happy to be joined this afternoon by the acting mayor of London of London and the medical officer of health, Middlesex-London Health Unit, Middlesex-London Health Unit. Dr. Alex. As always, we're happy to have the media in attendance as well. You to submit your questions to our Microsoft Teams. We do have a few in the queue, but we can always use more. All you need to do is click on the question mark inside the text bubble here on Microsoft. When you do, if you could indicate your name and your media outlet name and your media outlet as well as your question, and finally a welcome to those joining us this afternoon on Rogers Television, Facebook page and YouTube channel, viewers tuning in on the CTV London website. Before we begin this afternoon, just a reminder that this is our final virtual Thursday media briefing. The 21st of March, we'll be moving to a weekly schedule. We'll only have virtual Monday briefings on Monday afternoons at 2 o'clock. We will be switching the schedule on Monday, and again, this is our final Thursday virtual meeting. Let's get to our opening remarks right away. With Acting Mayor Josh Morgan.
Well, thanks, Dan. And I do feel like I finally got a regular spot on the show, and now you've canceled one of the episodes. I won't take any offense to that. I may preempt some of the questions that will happen throughout the course of this, because I am going to talk a little bit about today, because I know that's top of mind. And first off, happy St. Patrick's Day. Who is celebrating? I would say reports from our staff say that those out celebrating are responsible, keeping their safety top of mind. And I just want to say thank you to everybody who's choosing in a way that keeps them safe, in a way that keeps them safe, keeps them reduces risk in our community. Certainly in our community, COVID-19 is still present in our community, and people making great choices today, and keeping others safe is what's going to keep trends going in the right direction. The city is working with the London Police Service and all of its community partners, as we do every St. Patrick's Day, and we are prepared to respond if any celebrations get out of hand. Everybody on that team is working solely on community safety at this time, and I want to continue to encourage people to keep doing what they're doing. Have a great time, but continue to celebrate safely. And of course, once again, I wish everyone a happy St. Patrick's Day. With that, I'll turn it over to Dr. Summers.
Thank you, Acting Mayor Morgan. We are absolutely delighted that you have been part of our regular programming, and we're glad that every day you are with us, to say the least. Thank you to the media for joining us this afternoon, and happy St. Patrick's Day to all. The Middlesex-London Health Unit is reporting an additional 60 COVID-19 cases today, and no additional COVID-related deaths. There was, regrettably, one death reported yesterday, of which you may be aware. That was an individual in their 80s who had received 3 doses of the vaccine. When we look at hospitalizations in our region and across the province, they continue to decline, as do ICU admissions, but that decline is slowing, similar to what is being seen with the overall trend in COVID cases. When you look at our dashboard, you will see that the case volumes have plateaued, and there is certainly some early suggestions of a slight uptick, to be expected, given the change in public health protections that we've seen over the last many weeks. When we look at the projections moving forward, the Ontario Science Table did release some projections today. Again, there is uncertainty around those projections, as they don't have complete information with regards to the total number of people who were infected during the Omicron wave. But what is clear, the booster dose remains absolutely critical in avoiding hospitalizations and ICU admissions. An estimated 30% there was an estimated 30% reduction in the number of people that ended up in ICU, and nearly 40% reduction in the number of people that ended up in hospital, because of the success of our booster dose campaign that was activated in December. A huge community accomplishment, and for one, I am very grateful for it. The provincial masking mandate is to be lifted on Monday, March 21st, so just a few short days from now, but mandatory masking will remain in place at all MLHU clinics and facilities. When the provincial government's mandate is lifted, there will be some notable exceptions where masking will still be required. Those settings include public transit, healthcare settings, long-term care homes, and congregate settings. MLHU is considered, of course, a healthcare setting, but even in our non-clinical settings, our office spaces, we will still be requiring masking for employees and for patrons or clients at any time. Even though that mask is being lifted, as I mentioned, and for note, all of our clinic spaces, including mass vaccination clinics, as well as our pop-up clinics, wherever they are being held, will have patients and clients requiring masks. Medical grade masks will be provided if necessary to individuals that do not have one of their own, and those masks can be worn over the mask that that individual is wearing, or they may remove their own mask and replace it with what we provide. Thank you to everyone for complying and adhering to our requirements for masking. It's a critical way to continue to protect our staff and our collective clients. Beyond that, the health unit continues to recommend that individuals wear a mask when in indoor settings. It is an effective way, a simple way, to reduce transmission while we still see relatively high COVID case volumes in our community. We are certainly transitioning away from an emergency response to a more baseline response as a province and as a health unit and as a community. But that being said, there are tools in our toolbox, masking being one of them, that can reduce your personal risk when you are out and about. Use it. It's there for you, and it works. It's an effective way to reduce your risk, and I think it's an important consideration. As we enter the weekend, many people will start to return from spring break. And just a reminder for those who are, if you have been traveling, it's all the more important that you wear a mask for the first 10 days upon your return to the province. The reason for that is that wearing a mask doesn't just protect you, but it protects others. And you may have been exposed to COVID while abroad, and wearing a mask is a critical way to protect those around you. Lastly, in follow-up to the Acting Mayor's comments about St. Patrick's Day, we know that many people will be gathering with friends to celebrate after 2 years of not being able to do so. And as a reminder, we're certainly supportive of a good time. However, COVID is still here. And it is important that as you are celebrating, that you do so as safely as possible. Continue to wear that mask indoors. And if you are looking for resources to help reduce your alcohol-related risks as a party host, you can visit our website at healthunit.com/planningaparty, as well as check out our video on Canada's low-risk alcohol drinking guidelines, also available on our website. Lastly, if you're feeling unwell, stay at home. That is one of the best ways that you can protect those around you. With that, thank you for joining us, and back to you, Mr. Flaherty.
Thank you, Dr. Summers, and thank you, Acting Mayor Morgan. All right, we've got a few questions in the queue, and again, a reminder to the members of the media who are joining us this afternoon, if you do have a question that you'd like to ask Dr. Summers or Acting Mayor Josh Morgan, please do submit it here on Microsoft Teams. Just click on the Q&A button. That's the question mark inside the text bubble at the top of your screen. And when you do, indicate your name as well as your media outlet and who your question is for. All right, let's get into the questions. There was a question from Jennifer Beeman, and Jennifer, if you could take a peek, I sent you a note on that just to see if your question has been answered. So let's go to the next question. Jennifer Beeman asks, Dr. Summers, how will the health unit's response to COVID change in the coming weeks and months? What will the public notice?
Thanks for that question, Jen. Our questions will be, our operations will be gradually shifting to what I would describe as our baseline longitudinal operations. We will still look different with regards to how we do our work and how we structure ourselves as an organization than we did before the pandemic. But we need to start embedding our operational approach within the broader work of the health unit. Notably, what you will see over the next few months is more of the other public health activities return. Some of those have been put on pause for a few years as we've had to redeploy staff to support the pandemic response. We're now in a position through hiring as well as shifting of how we do our COVID work where we can continue on that path of doing the public health work we were doing before the pandemic, as well as continuing to support the community through the COVID pandemic. We will continue to have vaccinations available. We will continue to respond to COVID outbreaks in highest risk settings. From the public's perception and the public experience of our programming, there may be very little difference with regards to how they are currently experiencing our COVID response. Obviously, there won't be as many hours available at mass vaccination clinics at this time. Obviously, we are not calling every case of COVID-19. That's not new. But there will still be ongoing ways in which we are responding to the COVID outbreak, the COVID pandemic, and the ongoing presence of the COVID virus in our community. I'll also note we are also planning around how we can surge, particularly to support additional vaccination needs should the need arise. So that is also part of our plans.
Thank you very much, Dr. Summers. Let's go to our next question, and it is a follow-up for you from Jennifer Beeman at the Free Press. Dr. Summers, how long does the health unit expect to keep its visitor masking policy in place?
Thanks for that. EHID, Environmental Health and Infectious Disease Division. We are embedding the work of managing COVID cases and COVID outbreaks within the work of the Infectious Disease Control Team, which is also managing norovirus outbreaks, hepatitis A outbreaks, tuberculosis cases, etc. That team, however, is bigger, obviously, than what it was prior to the pandemic because we have substantially more work right now as a result of COVID in our community. But operationally and structurally, that effort to bring those programs together is unfolding as we speak and is actually close to fruition. That program is further substratified, of course, into responding to different sectors, and we're still learning the best way to structure that. The vaccine program was also independent from our pre-existing vaccine preventable disease program, which does vaccine distribution for all types of vaccine, school vaccine programs, the promotion of the safety and efficacy of vaccine, adverse events, reporting, etc. We are merging the COVID response from a vaccine perspective within the vaccine preventable diseases program. Again, that program is much larger now than it was before the pandemic, but operationally and structurally, those programs are starting to align with the COVID work. From a reporting perspective, just specifically, reporting will continue to be undertaken by our population health assessment and surveillance team, a team of epidemiologists and data analysts who report on all nature of illnesses, including infectious diseases. And we will continue to have the COVID-19 dashboard reporting during the week for the next while. You'll see some changes coming to the dashboard. We'll be announcing those on Monday, mainly just to reflect the different type of data we're now getting and the relevance of that data in the new pandemic response. But that dashboard is still going to be there for the foreseeable future, and then we'll reevaluate depending on the needs of the community. Thanks, Jen.
Thank you for your response there, Dr. Summers. You know, it's been so long that we've had the dashboard being updated every day that it's just become such a regular feature that you sometimes forget a little bit that's part of this response that is very much in the moment. Let's go to our next question. Kirat Valia is joining us from the Western Gazette. This question is open to Dr. Summers or Acting Mayor Morgan. I'm not sure how much you'll be able to say here, but Kirat's question is, while today has not seen any large gathering yet, do you predict this will change later in the day? If so, what steps will be taken? Acting Mayor Morgan?
Yeah, I can start with this one. I can't make a prediction on what will happen later in the day. What I can say is the observations that I made in my opening comments, and that is, so far today, it seems like those celebrating are taking care of themselves, taking care of each other, and looking out for our community. And if that continues throughout the course of the day, everybody's going to have a great day. That being said, there is a multi-organizational operational team that is ready to respond to any sort of situations where there are incidents that would warrant that response. And so hopefully things continue the way that they are. People are making good decisions, and if that continues, then we're gonna have a great day all the way through. So I can't predict what will happen, but I can tell you we are prepared if something does happen that warrants a response of some kind.
Thank you very much, Mr. Acting Mayor. And I think Dr. Summers, nothing to add.
No further comment from me. I certainly think the mayor has covered that.
All right, let's move on to the next question. Jacqueline LaBelle from Global News Radio 980 CFPL is joining us. Dr. Summers, Jacqueline asked, does the health unit have concerns about COVID spreading at St. Patrick's Day gatherings today? What advice do you have for people looking to celebrate?
Thanks for that question, Jacqueline. Certainly, we anticipate that COVID may spread through St. Patrick's Day gatherings today, as COVID will spread through any social gathering. As I mentioned earlier in the week, if you are heading out to a social gathering, especially a large one, and the probability that someone at that party is incubating or transmitting COVID-19 is very high. And essentially, you can presume that someone there is incubating or transmitting COVID-19, and therefore the probability or the chance of transmission exists. As I mentioned before, risk is neither black nor white. It's neither on nor off. It's a continuum. It relies and exists along a gradient. By deciding to go to a St. Patrick's social gathering, you're acknowledging an increased risk for transmission, but there are still things you can do to reduce your risk further if you are at one of those social gatherings. Wearing a mask as much as possible and only removing it if you are eating or drinking. Ensuring that you are up to date on your vaccinations. Ensuring that you are talking to your friends who you are celebrating with about their vaccination status, making sure everybody at the party or the gathering does not have symptoms of COVID-19. These are the same tools that we talk about in all settings, and they are equally effective today as we try to reduce our risk along that gradient, along that continuum. I would also highlight that it's critical that people monitor themselves for signs and symptoms always, and notably over the next little while if you did attend a large social gathering. Thanks, Dan.
Thank you, Dr. Summers, and thank you for the question, Jacqueline. Let's go on to our next question, and just a reminder that if you do have a question, please do submit it here on Microsoft Teams. Question from Sophia Rodriguez at CBC London. It's for both Dr. Summers and Acting Mayor Morgan. What would you say to students who plan on hosting large gatherings this evening? Acting Mayor Morgan.
Yeah, I'll start with that one again. So the question is about those who host large gatherings, I believe it was articulated. First off, I don't think anyone should host a gathering beyond their ability to manage that gathering properly. People want to host an event because they want people to come and have a good time. And if you host something that is beyond your capacity to control the circumstances at that gathering, that is putting people in a higher risk situation than necessary. As we know, and as Dr. Summers just said, COVID is still present in our community, and there is certainly a risk assessment related to any gathering. And as you increase the numbers, that risk assessment changes over time. We also know that at events where alcohol is involved, there are additional other risks to members of our community when that happens, including risks of sexual violence and a number of other circumstances. No one has a good time when someone gets hurt. No one hosting a party is going to feel good if someone at that party has something bad happen to them. And so my advice would be, don't host a party beyond your ability to manage it. Do not host a large gathering where you lose control over that situation, because at the end of the day, you are not going to feel good about the people who you're trying to provide an opportunity to have a good time for if something bad happens to one of those individuals. That's what I would say to those considering hosting tonight. That is the responsible thing to do, and that's how you look out for yourself, your party goers, and the rest of your community.
Thank you very much, Mr. Acting Mayor.
Dr. And I would, thank you. And thank you, Acting Mayor Morgan. I would echo everything that the Acting Mayor has just said. Again, noting certainly from a COVID perspective, that risk is there. We've commented on that. And then more broadly, from a safety perspective, avoiding injuries, avoiding severe outcomes is critical. And part of that is knowing what you as a host can manage. And so I would just, again, echo Acting Mayor Morgan's comments that knowing what you can handle as an organizer is absolutely critical.
Thank you very much. Let's go to our next question. Catherine McCutcheon is joining us from News Talk 1290 CJVK. Welcome, Catherine. Question for Dr. Summers. Will fourth booster shots be available soon for younger age groups in our population?
Thanks for that question, Catherine. I don't have any specific dates yet available to us with regards to fourth dose booster doses being broadly disseminated to the general population. We anticipate that additional booster doses will likely be required because over time, the protection from the vaccine against maybe a new variant or against symptomatic illness may wane. All that being said, we've seen significant sustained protection against hospitalization, but as I've said before, the third dose booster that we did in December through till even now provided even more protection against those that had received those first two doses against hospitalization. So I think that there will be another round of booster vaccinations for the general population at some point over the course of the year. When? Don't know yet. And it will depend on the evidence around when that vaccine wanes. And we're still waiting on that information.
Thank you, Dr. Summers. Next question is from Jennifer Beeman at the London Free Press. Dr. Summers, would the health unit dashboard transition from daily updates? Is this move to align with the province's shift in their data reporting?
Thanks for that question, Jen. For the time being, our dashboard will continue to be Monday to Friday and updated Monday to Friday. Over time, of course, we will have to reassess whether or not that Monday to Friday frequency is required. Really, when we look at the reporting and we look at surveillance, we are always wanting to do so from a place of informing public health unit action, community action, and always transparency, of course. All that being said, we want to make sure we're sustainable in our response, so we'll be monitoring that closely. But for the time being, it's still going to be Monday to Friday. That's not changing imminently.
Thank you, Dr. Summers. And I believe that brings us to our final question this afternoon. And this is a question for Acting Mayor Morgan, and it's from Jacqueline LaBelle at 980 CFPL. Acting Mayor Morgan, can you specify some of the organizations that are involved in today's enforcement response to St. Patrick's Day?
Yeah, thanks for the question, Jacqueline. And it isn't just an enforcement response. The Emergency Operations Center has an operational team. It involves a number of the relevant divisions of the city, as well as those involved in emergency services, police, fire, EMS. Of course, our bylaw is one of those on the enforcement side. But there's also communication with a range of community partners, including Western and Fanshawe, on an ongoing basis throughout the day, which contribute to the operational plans for the day. So I would say it's those organizations, but it isn't just enforcement. It is a larger operational group to provide those services and response capacity should the need be there. So I hope that answers your question.
Thank you very much, Mr. Acting Mayor. And that not only answers that question, that takes care of our questions for this afternoon's virtual media briefing. So that does bring us to the end of our final Thursday virtual media briefing here. We want to thank you for joining us, and a big thanks also to Acting Mayor Josh Morgan and Dr. Alex Summers for their insights, their information, and their thoughts about COVID-19 and to your questions this afternoon. All right, we will be back with our next virtual media briefing coming up on Monday, the 21st of March at 2 p.m. We hope you'll join us then. So between now and next Monday afternoon, have a great rest of your Thursday. Happy St. Patrick's Day. Have a wonderful upcoming weekend, And so long for now.